Way too many of this COVID-19 shutdown. I want to just start by thanking SFGov TV and those who are participating in this virtual press conference. Today, I am joined by the Department of Public Health, Dr. Grant Colfax, as well as the Police Chief, Bill Scott, the Director of the Human Services Agency, Trent Rohr, the Director of Housing and Homelessness, Abigail Stewart-Kahn, and I'm San Francisco Mayor London Breed, here to provide you with an update on what is happening with COVID-19 in our city. As of today, we have 1,994 cases of those San Franciscans who have been diagnosed with COVID-19, and sadly, we've lost 35 people and about 70 people have been hospitalized. And as a reminder, we want to ask folks to visit datasf.org/COVID-19 for more information. I have a number of announcements today, and I am excited to announce some good news for a change. I know that last Friday we made an announcement that on May 18th, there would be a number of businesses, including florists and bookstores and cosmetic stores and other places that will be allowed to reopen for pickup and delivery services. And the good news is that is still happening. The even better news is that we are able to extend this to all retail in San Francisco with a business that is actually directly connected to the street. And so what this means now for our city is incredible, because we're talking about many of those small businesses in various neighborhoods where you see many of those shops that are closed. They will be able to open for pickup and for curbside pickup and delivery, which is going to be incredible. This does not include malls, for example, but it does include all retail in San Francisco, and we're talking about close to 95% of businesses that have unfortunately been closed. To provide this opportunity to our small business community is going to be incredible, but I want to be clear that there, of course, will be limitations. There, of course, will be certain requirements around wearing masks, around maintaining social distancing, and also, ultimately, we want to make sure that these businesses understand and are prepared for these guidelines and are able to provide this level of service to the community. And I'm really excited about this because this is going to not only support the jobs that hopefully many will return as a result of this. This will support the communities and the people who love these businesses and want to see them continue. It's a continued step, of course, in the right direction. We also, I want to mention, will be allowing manufacturing and warehouses to open as well, again, under certain guidelines, and we'll be able to provide that information as well. Just so that we can continue to gradually reopen our city as we see changes in very specific indicators. Now, you know from the very beginning, what we've said was our guiding principle is the data, the facts, our public health officials, and we do appreciate what they have done to get us to this point where even though we continue to see, in some cases, the numbers increase, we do see the numbers flattening. They have not declined, but the fact is we are in a better place. Not where we want to be, but we're in a better place. And when making decisions around what opens in our city, we look at 6 particular indicators. And Dr. Colfax has talked about these indicators in the past, but I just want to remind people so that we are all clearly understand what those things are as we begin to allow businesses to open. What are we looking at? How are we making those determinations? Well, it's whether or not the number of cases are flat or decreasing. And we see that they are at least remaining flat. We look at whether or not our hospitalizations are flat or decreasing. And As you can see, they are still flat. And our hospital capacity is stable because we know that in the event of an outbreak or a surge, we have to be prepared. And the good news is we are in a good place. And we want to be able to at least get to a place where we could at least test over 1,600 people a day in our city. And the good news is we are almost there. In fact, I'm really optimistic that based on all of the work that's being done, especially with our Department of Public Health and community partners, we will actually get there hopefully next week. We have a comprehensive tracking program, contact tracing program, and we want to make sure that that program is at a capacity where we can act immediately once we identify a case. And finally, a steady supply of PPE. And yes, sadly, PPE is still a conversation that we're having. We have been very creative and very fortunate that we have had generous people who have contributed. Our partnerships with USF and their contributions and the support that they provided and other private hospitals. We have been fortunate, but we want to make sure that we have sufficient PPE. So those 6 indicators are exactly what's important to ensure that we as a city are able to open. And throughout the duration, as we gradually allow things to happen, we want to make sure that we are always looking at these indicators in order to determine what is best. So I want to thank the Department of Public Health, and I want to also caution everybody, because even though this is exciting, we still need to be very careful. It's because you all have been following the social distancing order and wearing masks and doing your part that we're even here in the first place. And the last thing we want to do is get too excited and then start flooding our streets with too many people where we see that it's a problem and then the numbers start to go up and then we have to dial it back and close some of these businesses. So the goal is to gradually move in a way where we start to get used to opening businesses, because the fact is we have to get used to the fact that the coronavirus is going to be with us for a while. So let's make sure that we are all prepared for what we need to do now and in the future to keep everyone safe. The more that you do your part, the more opportunities that we are able to provide to so many of our businesses who desperately need to open. I want to touch bases on that, just our budget impacts. And I know you've heard about the fact that sadly the city is experiencing a possible deficit of anywhere between $1.1 and $1.5 billion. And I just want to put that into context, because what is going to happen in the next year or two with our city, it's going to be even more challenging than it's already been. And even though we have had challenges and we still enjoyed decent economic times, there has always still been a need for more muni service, for more housing, for more resources in general. So now imagine all of our efforts and everything that we've done to get to this point. We are going to basically be in a situation where we're going to have to make really hard financial decisions. And just to give you a perspective, I signed this fiscal year's budget last year. And sadly, even before the fiscal year closes, we anticipate in our current fiscal year a $250 million budget deficit that we have to close. We also, for next fiscal year, are looking at possibly a $1.5 billion budget deficit. And we know that the city has put away about $800 million in reserve, but there's also limitations as to how that money can be allocated. And we also have to be very cautious. So what that is going to mean is hard decisions, hard cuts, impacts on services. And so I just wanted to put that perspective out there, because this doesn't even take into account the $375 million that we have already spent to help in the efforts around the coronavirus pandemic. That includes the hotels and the shelters and the testing and all of the things that you know we're doing. Now, we are hopeful and we expect most of it to be reimbursed by our state and federal government. But think about it. That may be now, but what happens in the future? We still need to do testing. We still need to do contact tracing. We still need to help our vulnerable populations. So whether or not those federal and state resources continue to come in is unknown, especially now that we know even the state is facing a $54 billion budget deficit. So the economy here locally, the economy in our state, in our country, and globally, it's going to be very challenging, and it's going to require a lot of sacrifices. In San Francisco alone, over 100,000 people have applied for unemployment insurance. So as I said, it's going to be critical that we start thinking about economic recovery in a way to not only get businesses open, but get people back to work and get our economy moving again so that we can continue to develop the financial support needed to address the many challenges that we continue to face. Now, in that effort, I want to talk a little bit about the economic recovery bond that we announced yesterday. And this bond is a work in progress. I introduced it at the Board of Supervisors yesterday. The goal is to support our city infrastructure like parks and roads and expanding our facilities for our most vulnerable populations, including those suffering with mental health and addiction. And I want to be clear that when we're talking about what happens with bonds in San Francisco, oftentimes we are taking other bonds that we have been supported by voters in the past. You have been very generous in supporting parks bonds, housing bonds, the last earthquake and safety bond. And what happens is we live within our means. So as we retire debt, we are able to assume additional debt. And we do so without raising property taxes. And that has been our consistent commitment, which is why every time we've come with a bond of this nature to the voters, they have been supportive and generous in providing the support. And I also want to be clear that this bond money we're not able to use it for operations. We are only able to use it for infrastructure. So that's why the ability to expand our mental health system and our programs and to bring those places up to standards, to expand our parks, which we are finding are even more important now than they have ever been, especially as we shelter in place. Our ability to look at our roads and our infrastructure and our bike lanes and to not only focus on those things, but to also really get our economy going, to get people back to work right away, and to do so in a financially responsible way without raising property taxes. It's going to be critical to our economic recovery. And so I wanted to just touch bases on that because I know there were a lot of questions that members of the public had about, well, how are we able to do a bond and we have this budget deficit? And that's exactly how. So I'm excited about what that could do. So we have to, again, start thinking about our recovery and jobs, and getting people back to work is going to be a critical part of that. I want to just talk a little bit about Give to SF. And I really want to say to those who have contributed to Give to SF, whether you were able to give $1 million or $1, it does make a difference. We've had large contributors, we've had small contributors. And yesterday I announced a contribution from Jack Dorsey, the CEO of Twitter, of $15 million to Give to SF. The ability for the city to address, again, many of these challenges has everything to do with state, federal support, but it also relies on philanthropy. And there have been, so many people who consistently step up when we ask, whether it's Mark Benioff and Salesforce, or the Hellman Foundation, or Ann and Gordon Getty, or Twilio and Google and some of the other folks. They have rose to the occasion. We know that there is much more that's needed, so we'll be continuing to do outreach. But I want to really appreciate even the small contributors who have really made Give to SF work in a way that has gotten money directly in the hands of people. And what's so amazing about what this program does is we have provided grocery store gift cards to families, people who are undocumented, or families who may not qualify for CalFresh or other subsidy programs. People who are maybe hairdressers and they have kids and they were not getting any government subsidy. People who traditionally were working jobs, barely making ends meet, but never qualified for subsidized assistance. So I wanted to make sure that those families were not forgotten. And this is a part of providing assistance with food, providing assistance with rent payments, and providing assistance to our small business community, which mostly employs a lot of these individuals. And so this program has been absolutely incredible. And I want to take this opportunity to appreciate some of the folks who have been on the front lines delivering these services. Ella Hill Hutch Community Center in the Western Addition. They've been preparing meals and serving food to families and people on a regular basis. Mother Brown's, who serves homeless populations in the Bayview Hunters Point community. In the Mission, the Carnival Committee, they've been doing an incredible job with getting food on a regular basis to the people in the Mission. And we've been working with a number of nonprofit organizations to get resources in the hands of people, because we know that sometimes these are people who may not qualify for unemployment, or they can't wait to get an unemployment check to feed their families. And so Give to SF, the resources it's provided directly to San Franciscans, has been invaluable. And again, I want to thank Jack Dorsey for his commitment to this program. And if anyone is interested, please go to give2sf.org. You can make contributions, or you can find out more information in terms of how you get support from this amazing program. So I want to just lastly touch on another program that I think is absolutely incredible and is being proposed through our Human Services Agency through the state. This program provides an opportunity under the CalFresh program for people who, for example, if you get CalFresh or Medi-Cal or foster care families, you'll automatically receive in your EBT card $365 additional per child. But if you don't necessarily qualify for any of these, but you also have children, you can still sign up for this program through the city. So we know that the school district, and we want to appreciate their work in providing meals at the sites for those families who need those meals during this time. But this is just an extra step, an additional program that has been absolutely needed to continue to support families. So if you have any questions and you want to sign up, please visit sfhsa.org or call 311. If you are a family and you have children and you are in need, please reach out to us so that we can provide you with the support and the assistance that you need. For those, again, who fit into the categories of CalFresh, Medi-Cal, or the foster care system, it's going to be a lot faster and easier for you to get those resources because you're already getting those resources. They're going to be automatically added. But for those who don't qualify, we want to get you, get your information and get in touch with you so that we can make sure that we get you signed up and get you your resources as soon as possible. And last but not least, I want to just say thank you to our disaster service workers. These are a lot of city employees who are working in so many capacities, whether they're here at the Emergency Operations Center or they're out in the streets, out in the communities, distributing foods, distributing masks. I mean, I've seen people at Muni bus stops just handing out masks for people who wanted to get on the bus, but they didn't have a mask to get on the bus. The kindness of so many of you and the fact that you're putting your lives on the line every single day, city employees whose responsibilities are things other than what they probably are doing right now, they have been the reasons why we're able to deliver as much as we're able to deliver in the city. So I really want to appreciate your work and what you're doing. And in partnerships with the Food Bank and the Salvation Army, GLIDE, and other programs, we've been able to deliver and also hand out hundreds of thousands of meals. So I want to be clear, we are not doing this alone. There have been programs, like I mentioned, St. Anthony's and Glide, they were doing it already. But the work that we've been doing together to expand the support to reach to unhoused people, to reach out to our immigrant communities and others has been incredible. So I just want to thank and appreciate everyone who's out there on the front line doing your very best to take care of others, because that's exactly what is going to get us through this. It has been a very challenging time, and as I said in the beginning, we're on day, I don't know how long, it's been a long time. But I do think that this weekend is, effective Monday, it's a great time to think about, some of your favorite places that you may want to support to arrange for delivery services or pickup services. So for example, flower shops were only available for delivery, and now the pickup from a flower shop is an option. The pickup from a cosmetic store is an option. Pickups from a lot of these retail businesses, especially in your neighborhood, is not only an option, but will be valuable if you can help to support them. This is how we're going to keep them in business. And I'm sure that since your kids are probably at home driving you crazy, now the toy stores are going to be available for pickup. Here's an incredible opportunity to get a distraction for them. So I just want to say again, thank you all for continuing to comply with this order and your patience. We are in this for the long run, but if we continue to do our part, wearing our mask, socially distance, the more opportunities will be available for us to enjoy. Thank you all again, and with that, I'd like to take this opportunity to introduce Dr. Grant Koufax with an update from the Department of Public Health.
Good afternoon. I'm Dr. Grant Koufax, Director of Health for the City and County of San Francisco, and thank you, Mayor Breed. As of today, there are 1,994 San Francisco residents with confirmed cases of COVID-19. And sadly, a total of 35 San Franciscans have died of the disease. While even one death is too many, I want to also stress to San Franciscans that by flattening the curve over these past 2 months, these past 2 long months, you have indeed saved lives. San Francisco's mortality rate due to COVID-19 is 4 times less than that of Los Angeles, and a remarkable 35 times less than New York City's. Thank you, San Francisco, for doing everything you can to slow the spread of the coronavirus here in San Francisco and in the Bay Area as a whole. You've truly protected each other, and you have protected populations who are most vulnerable during the pandemic. And today, I would like to talk about our path, our shared journey to recovery. We are anticipating, as the mayor mentioned, another step in that direction this Monday, when many retail businesses can begin to offer curbside pickup and takeout services. This is indeed good news, not only for businesses, employees, and customers who have been waiting patiently, but also because it means that our city is doing better. The number of people hospitalized with COVID-19 is staying flat. Since April 6, our hospitalization numbers have ranged from 70 to 94 patients. Today, there are 70 COVID-19 patients hospitalized across our 9 hospitals in San Francisco. As I said on Monday, this is the metric we would need to study before moving forward to open up more retail. And if all goes well over the next 5 days, we will be able to make that move. Here is a brief summary of the plan. The new policy will allow many retail businesses to begin curbside pickup, along with related warehouse and manufacturing businesses in their supply chain. The city's vision is to balance that very important and hopeful step with a continuing need to vigilantly protect community health. For example, the retailers that can do curbside pickup must have no more than 10 employees on site at any time, or fewer if the store is very small. Related manufacturing and warehouse work can resume if there are no more than 50 employees on site at one time. They will also need to abide by state guidelines for safety during this pandemic. All participating businesses must adopt a social distancing protocol and a health and safety plan. We are working in partnership with the Mayor's Office of Economic and Workforce Development and the Economic Recovery Task Force on the safest way to reopen our economy. Full instructions for businesses will be released tomorrow to allow them to prepare. And the formal health order will come out on Monday if the indicators are still good. Once that order is issued, businesses that are ready and able to satisfy the requirements can begin the next phase of reopening. This is a meaningful step on the gradual path to the new normal. As we take these steps, we will continue to keep a close eye on the data so that we can move forward or pause or even increase restrictions depending on the spread of the virus in the community. As well as we have done here, the challenges before us are tremendous. As we begin to carefully transition to a new phase, this new phase, we must balance a continued emergency response alongside embarking on our path to recovery. But remember, the virus doesn't have a timeline. In fact, if we move too quickly, it will get much longer. But the good news is that the way we live with the virus is largely under our control. There are 3 things that you can do to help, and I ask for your help. Please continue to social distance. Please cover your face with a face covering, and please get tested if you are working. These will keep us moving in the right direction. And I, as the city health leaders, pledge to do 3 things as well. Continue to expand testing access. Build our contact tracing system so it is among, if not the best, in the country. And improve our surveillance systems to detect outbreaks and respond as quickly as possible, supporting individuals who have been diagnosed with COVID-19, supporting their families. Together, with those actions, we will accomplish 3 important things. We will see a reduction in infections and deaths. We will experience and feel more safety and confidence as we continue to reopen. And we will ultimately recover and enjoy more activities, even in a world where the virus remains a fact of life. That is the task before us. San Francisco and the Bay Area is in uncharted territory. We are working hard at all levels and with our community and business partners to develop our local roadmap. And we are following key indicators in San Francisco and across the Bay Area to ensure that the virus remains under control. These indicators include hospital capacity, watching our hospitalizations to ensure that our health system is prepared to serve patients with COVID-19 and other conditions. Personal protective equipment, or PPE, ensuring that there are supplies for healthcare workers and first responders for at least 30 days into the future on any given day. Testing. We are continuing to expand testing in the city and are very close to meeting our goal of conducting about 1,800 tests a day. Contact tracing and supporting people to isolate and quarantine, and again, supporting them and their families and their neighborhoods with support. And continuing to develop a robust surveillance system for outbreak detection and response. Over the next weeks and many months, we will continue to monitor these indicators. We will work together with community, businesses, region and the state to accomplish as much restoration as we can. The coronavirus is still here, and we are going to find a way to protect each other and enter a new era for San Francisco. We will continue to rise to the occasion, and I am proud to be part of this effort. San Francisco, I can't thank you enough for your steadfast courage, sacrifice, and dedication to the health of the entire community. The way we have come together to flatten the curve proves that we can continue and will continue to build a new way of doing things. Thank you.
The first questions will be for Dr. Grant Colfax. First question is from Alex Berea, San Francisco Business Times. Do you anticipate making any modifications to the restaurant dine-in restrictions before May 31st, or releasing guidelines on how restaurants will be allowed to operate in San Francisco when they do reopen?
So I think it's important to emphasize that this will be a gradual process to a new normal as we learn to manage our work, our work and our efforts and our activities in the setting of COVID-19. So there will be a gradual reopening with looking at the indicators that I talked about, monitoring that carefully. So there will be a gradual restoration, assuming those indicators give us the confidence to continue to move forward. Monday, the 18th, is a big step in that direction. With regard to specific guidelines for restaurants, those would, of course, be issued in advance of any modifications required, but I do not have a specific timeline to share with you at this point.
The next question is from Carrie Sisto, Hoodline. What is the status of the meth sobering site at 180 Jones Street? The site is currently an empty lot guarded 24/7 by a city-contracted security service.
So, As we know, the behavioral health issues in San Francisco continue, and certainly we are committed to ensuring, and we have ensured as much as possible that people who have behavioral health issues, including meth addiction and dependence, are provided with care and treatment. We've continued those efforts both on the street, in the hotels where people are sheltering in place, and also for people who are living with COVID-19. I think that with regard to this actual sobering center, my team is looking at that effort going forward. I can't speculate on the specific site at this time, given that we've been in the middle of a pandemic since March, but certainly we recognize the need for continued behavioral health care, especially for people who are living with and using meth. And a sobering type model is supported by the science, and we look forward to figuring out how do we build a sustainable behavioral health system that reflects the new reality in which we're living in. How do behavioral health services continue to be delivered and strengthened and intersect with the real needs of people who are living with behavioral health issues as well as at risk for COVID-19?
As a follow-up, could that empty site at 180 Jones Street, which is on a block with multiple encampments, provide another safe sleeping space since it is unused during this time?
So I can't speculate on this specific site at this time, but certainly safe sleeping sites are being considered in a number of areas in the city, but I can't speculate on that right now.
Next question is from Melanie Woodrow, ABC7. Once those businesses reopen, will the 6 indicators be monitored daily, and by whom?
So those indicators are monitored by the health department. You can go to our COVID-19 data tracker and follow most of them with regard to hospitalization curve, the testing data, and other indicators. So we will be monitoring those at the health department on a daily basis, in conjunction, I should say, with other health departments across the region.
If the numbers begin to slide in the opposite direction, would businesses be immediately closed again? Would you move back to phase 1?
So I think, again, we've always followed the data, science, and facts, and we would look at the specific issues where there appeared to be, that would be cause for concern, and make a decision on whether certain businesses, certain practices, certain areas, or certain neighborhoods would need a more robust public health investment. I can't speculate on whether an entire system would be changed as a result of those indicators. But I do think we need to be clear. We are gradually phasing in. We are watching those indicators. We certainly all hope with the collaboration and support of San Franciscans across the city that the public health measures that we will continue to maintain will continue to flatten that curve or have that curve go down. If in fact the indicators go in the opposite direction, we will investigate in as quickly as possible and make decisions based on the data about where and when we may need to scale back.
Next question is from Liz Kreutz, ABC7 News Bay Area. Is the Bay Area also planning to extend the shelter-in-place order for the next 3 months or longer, similar to Los Angeles County?
So again, I think that we are continuing to monitor the data, looking at this gradual, step-by-step reopening, and ensuring that we take a reasonable approach that balances the fact that the really good news is that compared to other places in the state, including LA, we are in a stage where we feel comfortable moving to this next phase. And again, we will iterate depending on what the data show over the next few weeks and months in terms of the next phases to reopening.
The next question is from Katie Steinmetz, Time Magazine. The city said in late April that it had the capacity to test 4,300 people per day. Mayor Breed said the city hopes to be running 1,600 tests per day by next week. Why is there still a sizable gap between capacity and how many tests the city is still running?
Yes, so I think I appreciate the question. It's an important point. So when we talk about that level of capacity, it's basically the machines that are at the health department and other parts in UCSF and other parts of the city, the machines that can actually run those tests. But in order to actually get those tests into those machines, a lot of things need to happen. We need to have enough supplies to do the testing. That continues to be a challenge. It's getting better, but it's been a challenge ever since this pandemic began. We need the people on the ground, the staff who are collecting the samples, and that's something that is very challenging in this dynamic. They have to wear the personal protective equipment. The tests take time to actually do, and then we actually need to have people come in for the testing, and we've seen an increase in our test over the past few weeks, a dramatic increase, but we need both the people to come in for testing, the supplies to do the testing, the staff to do the testing, the sites, scaling up the sites in different neighborhoods. We know that not everybody can access a specific site that you might have capacity if it's across the city, if they need transportation, and so forth. So we need to develop this broader culture of testing where people get tested on a regular basis and have universal access to testing. We are moving in that direction. We have the machines ready, but now we have to create the structure and the culture to meet that goal of at least 1,600 tests a day going forward.
Next question is from Kathy Novak, KCBS. As certain counties in California move into stage 2 of the state's roadmap, are you concerned about San Franciscans traveling more between counties that have different restrictions?
Well, again, I think that as I've said, the key to this is ensuring ongoing social distancing, that people wear face coverings, and that people get tested. So I think that with across the state, as testing efforts scale up and as communities adopt social norm of wearing facial coverings, I'm hopeful that San Franciscans will take appropriate precautions if and when they do travel.
Thank you, Dr. Colfax. The next questions are for Mayor London Breed. Madam Mayor, your first question is from Maura Dolan, LA Times. What is your reaction to San Mateo County going to phase 2 while the rest of the Bay Area moves more slowly? Why do you think San Mateo is doing this?
Well, I can't speak to what San Mateo is doing, but I think that we are, in the announcement today, that we are able to open retail for drop-off and pickup has been incredible. So I think we are taking probably a great step forward, and I think I want to be clear that every county is different, and every county's numbers are different. And so their county health officer and how they make decisions, I can't speak to, but I know that we are looking at the data, and as I talked about in the 6 indicators, we're making decisions on what can open and when based on those 6 indicators, and that's why we're able to move forward on May 18th. Last week, we made an announcement that it would only be a certain limited number of stores and locations, and now we've expanded that to not only include all retail in San Francisco that had curbside businesses, but also manufacturing and warehouses. So I think that is very significant.
The next question is from Heather Knight, San Francisco Chronicle. The closures of several streets in San Francisco, JFK Drive, Shelley and McLaren Park, Great Highway, and Twin Peaks have been very popular among San Franciscans. Have you considered extending those closures beyond the shelter-in-place order and making them permanent?
I think that it does depend on what happens in the future, because we're in a situation where, COVID-19 is going to be with us for a while. And so as businesses start to reopen, as people start to get back to work, things are going to be a lot different than they were before. So it won't be that we reopen the city and then all of a sudden things go back to what they used to be. And I think that we will evaluate every street closure and every decision that was made and make a determination as to whether or not we should continue or whether or not that street is needed for any other purpose. So it's hard to make a definitive it's hard to make a decision at this time about whether or not that will continue, but we will evaluate those locations on a regular basis. And I also want to just remind everyone also that Sunday Streets, which was a program before this pandemic, was a very popular program in choosing various neighborhoods to close streets. So we want to continue to provide those as opportunities, and so that will be taken into consideration.
The next question is from Holly McNeed, KQED Radio. Given the major budget deficit, which agencies are you most concerned could face the most significant cuts?
I think that everything is up for discussion. And when we think about how far we've come and how we have expanded services and what we've done as a city, and now we're facing a deficit that is something that we have not experienced before, we all have to be prepared. We all have to brace ourselves. Everything is being considered. And it could mean challenges to services with Muni, with our police department, with our fire department, with homeless services. Everything will be up for discussion. And the goal, of course, is we want to maintain excellent service. We want to maintain our street cleaning and all of the things that are important to the people of this city. But everything will have to be considered.
The final question is from Tricia Thadani, San Francisco Chronicle. Before the pandemic, you and the Board of Supervisors were working on Mental Health SF, a massive and costly plan to revamp the city's behavioral health care system. Where does this plan fall on the city's priority list now? Is the plan still realistic as currently written?
Well, I think that many of the things that we have been working on before, there might be a need to shift our focus, not to necessarily not continue to move forward and push for the things that we know aren't necessary. We, in fact, in the bond that I just talked about, the recovery bond, there are proposed support for our mental health facilities. The goal is to expand our mental health facilities and to make them available for many of our vulnerable residents. And I want to have really, the ability to do this and to move faster, but everything has to be taken into consideration when you're talking about, again, a huge budget deficit. It's going to be important that we're able to at least hold on and maintain many of the services that we have, and I hope that we will be able to enhance some of those services, because the problems that existed in San Francisco before this pandemic were challenging. Around mental health in particular. It's why we care so much about that investment and why it's important that we are going to keep that at the forefront of our thoughts as we move forward in this budget cycle to try and figure out the most financially responsible way to implement as much as we can.
Thank you, Madam Mayor. This concludes our press conference.
Thanks.